Hello, my people. It's another week. It's another day to learn. We say learning must be continuous through each and every day of our lives. You must learn something. Even if you learn how, just use something correct. That's learning. Even if you learn how to work correctly, even if you learn how to learn, that's very right. So today we are going to review a product. It's a medical product. I know most of you maybe have interacted with this drug. It's called Imodium. That's the original drug. And then we have coramide, which is the same chemical components, but it's not a fake drug. It's a generic product. So we have the original here, and then we have a generic product here. So our first rule became, when you are given a medication, please check inside where we have a sheet inside. So for this one, it doesn't have, the coramide does not have. So it's in capsule form. You can see it. Yes. Let us keep it aside a little. Then we have Imodium. It has a prescription inside. It's also in capsule form. Each capsule is 2 milligrams per each capsule. So the reason why we want to review and see this thing, it's the main reason, because we want to learn, we want to know how to be using medical products the right way. We want to know how, where we don't want to mess up. We don't want these drugs to come and affect our health. It is indicated. Please read all the leaflet carefully before taking this medication, because it contains important information for you. It's leaflet. You may read it again and again for increasing your knowledge. Number one, who should not use Imodium? Number one, there are those people who are really affected with this disease called IBD. IBD is an inflammatory bowel disease. That one is it is diagnosed through tests that are done by us in the medical field. You cannot diagnose yourself with IBD. Number two, it's not to be used with those who have pseudomembranous colitis. Pseudomembranous colitis comes from where? It's a type of diarrhea that you get from using antibiotics for long. They actually kill your normal flora and fauna of the stomach. Not flora and fauna, but normal flora. That is normal bacteria in your stomach, because naturally you have bacteria that help in synthesis of enzymes, in also in absorption, and also keeping the gut at a balance, at an equilibrium, or at homeostasis. So if you have sodium membranous colitis, you should not take loperamide. Or loperamide is the chemical drug, but the trade name is Imodium. So we also have those who have acute bacterial enterocolitis. You come with diarrhea for 2 days. You don't know where this diarrhea came from. You have fever, you have signs of inflammation, that is fever, you have that diarrhea, you have weakness of the body, you are feeling nauseated and all that. It's a sign of that is a sign of a bacterial infective type of a diarrhea. Then we go to another if you have blood in your stool or fever, that is those we have already said that is the acute name. You have also those who are allergic to loperamide. Those who are allergic to some types of drugs that are called loperamide, if you are allergic to it, you should not take this drug. So another special precaution for those who use this drug, it should not be used by anybody with the age of below 8 years. You know why? Because this drug, it affects your motility. So you have to be careful when taking this drug. Yes. Another thing that you should take precaution. If you have some doubt, ask your doctor or pharmacist. If you just have this drug and you don't know how to take it, maybe you're asking yourself some questions, you're not sure, better ask. Kuuliza si ujinga. That is a common phrase that was taught by my teacher back in primary school. You should discontinue if there's no improvement, you're not feeling better, please stop. Also, if you develop intestinal obstruction, that is your bowel become your stomach in a fura, that is becomes big in size, you should not take this diarrhea anymore. You should not take this drug anymore. So after that, let's see some of the adverse effects, some side effects of this drug. It is very simple. It is here. You always take this leaflet, and also study it for your own self and for others. So we have like other medicine, this medicine has can cause some side effects. Number one, which are not known. Actually, they are not very common to everybody. So this one you have to be careful. So we have abdominal pain, upper abdominal pain leads to the back, tenderness when touching the abdomen, that shows an intestinal obstruction. you should be careful when using it. Vomiting, you also have vomiting. You have also symptoms of inflammation such as acute pancreatitis. That one you shall diagnose it ourselves, not you. So the following are disable effects again. We have dry mouth, severe constipation. Those are just some of the side effects that you may experience. They have narrowing of the pupil, somnolence that you feel you are much sleepy. Then we have fatigue, difficulty in urination, and then we have skin rash, sometimes very severe. For those who are allergic to this drug, and then you take it, you shall have something called Stephen Johnson syndrome. That is the skin rash. It becomes more severe and it shall disturb you. So this drug, again, remember we said do not give to children below 8 years and below. That is adolescents, some of the adolescents, and also some of the children and adolescents. You should not give this one to a unit 1 year old. No, why? Why should you give? Treat the cause. When you come to the clinic or you come to my pharmacy, I'll ask you I'll try to ask you how have you been feeling. I want to know the cause of this thing, so that when I'm treating you, I'm not only treating the symptoms, but I also want to treat you properly, so that I can treat what is actually disturbing you, not only symptoms. Symptoms might improve, but you may get back to me and tell me daktari sijapona, and I don't want that. I want you to go home safe and secure and sound. So again, now let's read how even you are supposed to take it. For acute diarrhea, you start with 2 capsules. There is I saw a prescription whereby you have been it was wrongly prescribed, so I had to change it. So in acute diarrhea, you start with in adults, start with 2 capsules. After each start with 2 capsules, then after each and every row stool, you take another capsule, but you should not exceed the six capsules have 12 milligrams. It should not exceed the 8 milligrams 8 capsules of this. So you should not be taking it at excessive amounts. So as I have explained, let me read again. Then after each unformed stool, take an additional capsule without exiting 8 capsules a day. In children over 8 years of age, start with 1 capsule, and then after each an unformed stool, you take one. It should not go to a maximum of 8. 6, not 8. Now it's 6. For children, you will take 1 capsule, and then you take one until the maximum of 6. That is after every rose diarrhea, every rose stool. Again, remember, we said what is diarrhea? Diarrhea is 3 or more times of loose stool. Do not forget that. What is diarrhea? It is 3 or more times of loose stool in an adult who was previously normal. Again, in chronic diarrhea, now this is how you take one capsule 3 times a day, and that's it. That's how you take this medicine. Please stop misusing this. Treat your diarrhea. Again, let me give a remedy for your diarrhea. You take ORS. That is oral hydration salts. For example, you can do homemade ORS that you can do. How do you do it? You just take some sugar, little sugar, and also some salt. You add to water, some lukewarm water, then you mix. That's how you get the ORS. That is homemade ORS. That will help in improving in returning your fluid that has been lost, and also that one will be useful to give you some energy. The sugar that you put inside, it's just a little to make sure that you hold energy you have lost is recovered, and your body is able to stay in a homeostatic manner. That is means it is able to work optimally. Again, go be treated. Don't take this drug for acute diarrhea anyhowly without knowing your cause of diarrhea. What are the causes of diarrhea? We have viral diarrhea, we have bacterial diarrheas. For example, we have E. coli, we have viral like rotavirus for children. And also we have acute food poisoning. We also have even excessive alcohol intake. We have IBD, now the inflammatory bowel disease. But those are diverse causes of the diarrhea. So take care, my people. Remember to subscribe, like, and also share with your friends. On my platforms, Dr. Charles Cairo, we are together in this. So make sure you take the medicines properly and take care, my people. Your health is your wealth.